When it comes to the assessment and treatment of foot disorders, we need to make sure we don't neglect the toes. But so many people seem to forget this, and this is a big problem, right? Because we can't forget the fact that the toes, and specifically here we're talking about the metatarsal phalangeal joints, are going to be a very key segment when it comes to proper foot function. Remember, with walking and running, the metatarsal phalangeal joints need to extend to allow for an effective push-off phase of the gait cycle. So we need to make sure there's adequate flexibility and strength through these joint segments and through the surrounding muscles. But this isn't just important for gait disorders, because muscle and joint restrictions and imbalances within the toes will be a common player with a number of midfoot and forefoot disorders. Now, in a previous video, we went over how to assess for proper toe and metatarsal phalangeal joint function, so I won't bother going over that again here. But for anyone who hasn't seen that video, I will post a link in the description below. But just to very quickly review, one of the key things we need to look for with respect to toe function is to determine if there is adequate flexibility of the toes. And again, you can refer back to that video for a detailed procedure on how to do this. But in this video, I want to go over what to do when the test reveals limited flexibility. Now, when this is the case, we can certainly use various manual therapy techniques to target these areas of restriction within the soft tissues of the foot. But what I really want to do here is we're going to go over some key stretching and exercise options that we can prescribe to help address these limitations. And just as one last reminder, if you do use our exercise software, you can of course find all of these exercises in the exercise library. You can search for the exercises by name within the library itself, but to make finding and prescribing any of these exercises easier and to save time, you can also find all of these exercises within the exercise group section. Here you can find it under the title Foot and Ankle, Flexibility Breakouts for Toe Extension and Flexion. All right, so with that said, let's take a look and review the exercises. All right, so there's actually quite a bit we're going to cover in this video. We're going to talk about how to address both flexion and extension restrictions in the toes. But if you recall from a previous video, we also need to think of the toes as two separate segments, right? Because we have distinct anatomy and neural networks that will go to and control the big toe, as well as the four smaller toes. All right, but what we're going to see is there's going to be a very common theme amongst these exercises. Essentially, we're applying the exact same techniques and the exact same stretching and flexibility principles. We're just applying them across these different parameters of the toes. So maybe it'll be simplest to start with talking about toe extension. And we're going to start here with the big toe. So what we're going to do is we're going to start just in this kneeling position, but just as a side note, we can really adapt any position that we need to, as long as we can reach the toes with our hands and we can have the foot resting on something. Again, here we're just using the floor, but there would be nothing wrong with using a stool that's elevated a little bit. Like I said, anything that we can just get the foot on to, to be able to reach the toe while keeping the foot flat. So what I'm going to do here is just reach down, and I'm going to use my top hand here, and I'm just going to very gently kind of press down on my foot just to stabilize. And from here I'm going to use my other hand to pull up on that big toe. And one of the really key important things here is as we're pulling up on that big toe, we're going to make sure that that metatarsal phalangeal joint of that first toe is going to stay firmly planted on the ground. Remember what we're doing here. We're certainly stretching this motion, but this is going to be something that we're going to need to happen with gait. All right, and so during that gait cycle, we of course need that metatarsal phalangeal joint to stay planted on the floor and on the ground, because that's going to form the front or the anterior surface of our arch here. So we need to make sure we're employing that same technique while we're doing our stretch. So like I said, we can just slightly press down with our top hand, and then I'm just pulling back on that toe, pulling back until I just feel a little bit of a stretch through the plantar aspect of the foot. Now remember, from an anatomy standpoint, there's going to be multiple structures that may limit this motion of the toe. All right, it can be the joint capsule itself, but it also may be that plantar fascia or any of those short toe flexors that go to the first toe here. And what that means is you have the potential to feel the stretch in any of these areas. But as a general rule, as long as we're feeling a stretch along the bottom of the foot, that can be into the joint capsule itself or into the plantar aspect of the foot, this is going to be what we are looking for an appropriate response. The other thing to keep in mind is we don't want there to be a closing angle pain on the top of the foot. That can be an indication that as that toe is coming back, it's pinching on the front, or excuse me, pinching on that dorsal aspect, and that's not the response that we're looking for. So we may need to modify if that's going to be the case. All right, but assuming we're feeling that stretch along the bottom, again, I'm pulling back, and I can just have this as just a nice, easy, basic static stretch. I'm just pulling back to a tolerable level, stretching that plantar aspect of the foot. And this we're going to typically hold some of these static stretches for 30 seconds or more, and we're going to typically perform 3 repetitions of that stretch. Now, the other thing that we can do here is that we can start to apply more of a PALS or a contract relax component of this cycle. All right, so in this case, it's going to be a very similar setup, pushing slightly down, keeping that metatarsal joint down. I'm going to pull back on that big toe, kind of create that stretch through the plantar aspect of the foot. But from here, I can add contraction. So what I'm going to do is maintain that angle of the toe with my top hand here. And I'm going to take my foot, I'm going to take my toe and I'm going to press down actively. So I'm tensing into my hand, but my hand is blocking that motion. So it's an isometric contraction. I can hold this for 10 seconds, slowly let it relax. And what we will typically find here is that as that toe relaxes, but we haven't changed length, we'll have a little bit more give into that toe as we let it go. And what we can do is using this top hand, we're just going to pull it back a little bit farther to engage that stretch and engage that end range barrier. I can then hold this relaxed static stretch for 10 seconds, and then I can do it again, pushing that big toe down into my fingers, holding 10 seconds, slowly relax, let that muscle relax, let the toe relax, pull back a little farther to engage that extra range that we just created with that contraction. And a typical prescription here is going to be repeat these contract, relax, and then stretch cycles 4 to 5 times during each individual stretch. Now I can also use this exact same procedure, but I can apply it to the lesser toes as opposed to the big toe. So here, again, foot is flat. Metatarsals are going to be resting on the surface that our foot is on, whether that's our floor here or whether we're up on a stool. I'm going to lightly just kind of stabilize the top of the foot, but now I'm going to take my hand and I'm just going to use that contact on those lesser toes, and I'm going to pull the lesser toes back into the air here. I'm trying to pull that metatarsal phalangeal joint into extension. And just as we saw with the big toe, we are going to expect to feel this tension and feel this stretch along the bottom or the plantar aspect of the foot. This could be at the bottom of the foot through the joint capsules themselves. Oftentimes we're going to feel it through this forefoot with some of these intrinsic muscles, but really as long as we're feeling it on the bottom of the foot, through that plantar fascia, through that flexor digitorum brevis group, that's really what we're shooting for here. So again, from that setup, I'm pulling back, create that stretch through the plantar aspect of the foot, and I'm going to hold this stretch typically for 30 seconds, and I'm going to use at least 3 repetitions when I'm prescribing this exercise. Now, the other thing we can do, again, just as we saw with the big toe, is we can add a contract, relax, or a PALS component to this. Here, the setup is going to be exactly the same. I'm going to have my foot flat, metatarsal stay on the ground. Using my top hand, I'm going to pull the toes back into extension. As I'm holding that tension and holding that stretch, I'm going to contract. I'm going to press these lesser toes down into my hand. I'm resisting that contraction, resisting that flexion with my hand, holding that isometric contraction for 10 seconds, and then I'm going to relax. Again, I'll give it a moment to relax, and then I'm going to try to pull those toes a little farther back into extension to re-engage that stretch, re-engage that tension, and then I'm going to hold this relaxed stretch for 10 seconds, and I can repeat this 4 to 5 times with each stretching session. Okay, so we can also use this exact same procedure, but instead of applying it to toe extension and targeting the plantar aspect of the foot, we can try to do it to target toe flexion, and this is more targeting the dorsal aspect of the foot. Now here we're going to use a similar setup where we want our foot to be resting, but if we have our foot just resting flat on a stool or the floor, we have a problem because we can't really engage the flexion of the toe. So what we're going to do is we're just going to have our foot propped up on something. A book will work, but yoga blocks work really well for this type of thing. So all I'm going to do here is have my foot just up on the block. And like we talked about before, I want that heel to be flat. I want the metatarsals to be flat along the edge of the block, but I need my toes to be free to move. And if we're talking about the big toe, now instead of pulling the big toe back, we're going to press the big toe down. All right, so we're going to try to create flexion through that toe. All right, so we're trying to create that pressure down. And as I'm doing this, what I'm going to feel, or what I should feel, is tension and stretch along now the dorsal aspect, either along the metatarsal joint itself or into the dorsal part of the foot. So here we're creating that tension down, really trying to push down to create that stretch. And if we're doing this as a static stretch, we're going to hold this stretch for 30 seconds, and we're going to repeat this for at least 3 repetitions with each stretching session. All right, now if we wanted to add our contract, relax, or our pails motion to this, it's going to be done very similar in that I'm pressing down, trying to create that tension and stretch through the dorsal aspect of the foot. But now I'm going to use contraction, but now I'm trying to pull this big toe up this way into extension towards my fingers here. So I'm pressing up with that toe, but I'm blocking that motion with my fingers. I'm going to hold that tension, hold that contraction for 10 seconds, and then I'm going to relax, give it a second to relax, and then just press that toe a little farther down into flexion. All right. Hold that stretch, hold the relaxed stretch, 10 more seconds, and I can repeat again. I'm going to press actively, extending my toe back into my fingers, blocking that extension motion to keep the contraction isometric. 10-second contraction, relax, and then pressing that toe a little farther down, really trying to get it to flex down over the edge of that block. Of course, we can do the exact same thing if it's more the lesser toes that we're trying to target. All right, this is going to be a very common thing that we're going to need to use with forefoot disorders, particularly things like metatarsalgia. Okay, so here the procedure is the same. Foot is resting on the block, ball of the foot is resting on the edge of the block, and I'm going to press the toes down, but instead of pressing the big toe, I'm trying to press through those 4 smaller toes. All right, I'm pressing down, trying to really get that flexion motion to happen at the metatarsophalangeal joint. If I'm going to use this as a static stretch, I'm going to hold this tension, hold this stretch for 30 seconds, and I'm going to repeat at least 3 times during my stretching session. Okay, now, if we wanted to use contraction, use our pails or our PIR, what we're going to do is from this press down position, I'm going to start to extend my toes. But again, I'm trying to extend my toes back, like I'm trying to bring those toes up into my hand. I should feel that contraction along the top, the dorsal aspect of the foot. I'm going to hold that for 10 seconds, and then I'm going to relax. As I relax, I'm trying to press that toe a little farther down into flexion. Typically here, we're going to prescribe 4 or 5 of these contract relax cycles for each stretching session.